You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess Dyer
and Dr. Sarah Scheinman.
And today we are going to talk about 99 ways to die and how to prevent those things. We have an amazing special guest today. We'll introduce her in just one moment. And you'll hear that her background is in emergency medicine, which is near and dear to my heart. I think I've mentioned a few times I'm married to an ER doctor, Ethan. So I hear all of his stories. We'll talk more about that in a moment, but really excited about this episode. Before we do, we like to kick off the episode with just a super brief recap of something that's happened in public health. We are recording this on December 9th. Just a few days ago, the ACIP met. As a reminder, that's the CDC's Advisory Committee on Immunization Practices. There's a lot we could say about that. We've talked about it in our Substacks and in our posts, so definitely go check those out. But one of the big takeaways was that they voted on the hepatitis B universal birth dose of the hepatitis B vaccine. And unfortunately, they voted to not recommend the universal vaccine. For many of us in health science, we are really horrified about that because the vaccine has done such an incredible job at preventing hepatitis B, which in infants in particular, if a child is infected with hepatitis B, it leads to all kinds of chronic disease issues, problems throughout the lifespan, including cancer, liver cancer, which is obviously something that we want to prevent. The birth dose is very important because it is a safety net. Not all mothers have access to prenatal care and testing. Testing is also not always 100% perfect. Children can be exposed to hepatitis B shortly after birth from loved ones who don't know that they're infected. The hepatitis B vaccine has an incredible safety profile, and so this was really bad news for those of us in public health and health science. So again, not a great update. We'll be talking a lot more about this and lots of other things that came out of ACIP. But that's the recap. Sarah, without further ado, would you like to introduce today's amazing guest?
I would love to. So I'm so excited today to be joined by Dr. Ashely Alker, MD. She is a practicing emergency medicine physician and adjunct professor at George Washington Medical School. Dr. Alker specializes in using media to create accurate public health messaging. She has been featured in USA Today, BBC World, San Diego Union Tribune, TED Med, and TEDx San Diego. Ashely also contributes to public health education as a medical technical consultant and screenwriting editor for over 20 television shows, including TV and film for Netflix, Hulu, HBO, CBS, Disney, and Apple TV. And just as an aside, I checked out some of your credits, and I'm a big fan of like 99% of the shows that you've consulted on. So thank you so much for making accurate medical information a part of our media consumption.
I will say I mostly give hats off to the producers and writers, the screenwriters on those shows for taking the time to talk to me because they don't have to do that. And they do it because I think they care about public health and their power to kind of increase accurate information, but also it makes better art.
Oh, yeah.
And I think a lot of them are invested in that, obviously, as well.
Hey, question for you. So Ethan, he always said he was obsessed with Scrubs.
Oh, yeah. A lot of doctors are. I think it's just because it's funny and just easy to watch.
You know what I think? He always said it captured, I guess, that when you're a resident, that the ethos, exactly.
Yeah,
so
Scrubs is so good.
Well, I think, and Dr. Cox, Dr. Cox is so realistic and like such a medical mentor, I think. They're coming back. Did you see that?
Oh my God, are you serious?
Yeah.
They're doing a reboot?
Mm-hmm. With everybody. I know, get ready, enjoy.
Oh my God, I'm jazzed. Are you consulting on it?
No, I wish. I reached out to them, but I think that they must have it covered or, something like that.
Before we get into this, and Sarah, I know you're going to ask the kickoff question that we ask of all of our guests. I really do just want to give a shout out. Yes, I am biased. I'm married to an ER doc, but I think that you're all absolutely amazing and don't get enough credit. I can't even imagine having to know a little bit about all the things and just be prepared to navigate whatever shows up in your emergency room. And I see when Ethan comes home, I see it on his face, the unbelievable weight of that, and, seeing obviously not all happy endings and, tragic outcomes. And so I know we're going to talk about that today, but just want to give a shout out to all of the clinicians tuning in, especially the ER docs who I can't imagine. I would crumble. I get paralyzed at the thought.
Yeah, some of it's not fun. Honestly, but it's nice to be able to be there for people on their worst day, and I think that's where a lot of the doctors in emergency medicine, especially, kind of get their superpower from, is the patients. So, but thank you.
Yeah. Sarah, do you want to ask?
Yeah. So, Ashely, we like to kick things off with a question, which is, what's a news item that has caught your attention just recently, and why do you think people should care about it?
Yeah. Unfortunately, there hasn't been a lot of good news recently.
No.
Not at all. The stuff that's been catching my attention has been all of the vaccine stuff, because it's pretty devastating. The first being the CDC's change in language on their website regarding vaccines and autism, which has shown no link, but the wording on the CDC's webpage is very confusing and really inspires misinformation. And then secondly, as Jess had mentioned, the hepatitis B vaccine for infants, that got pulled back. And that is something that's going to cost us lives. So that is really painful for a lot of people in medicine and public health, because they know how powerful it has been and how many lives it has saved. And, as Jess had said, especially in infants, this is a very serious thing, because over 90% of those infections will become chronic, and half of those, I think it's a fourth actually, of those children, which is still way too many,
right,
will then pass away from a disease related to the hepatitis B itself. So that is too many lives lost that are very preventable. And the same with, measles and whooping cough and all these things that we're seeing in the news right now. And it's just very unfortunate, because we're taking steps back in public health when we have the power and the science and the medicine to take steps forward.
Right. One other thing, I mentioned it before we hit record, but I was just reading an article published in JAMA that uptake of the vitamin K shot is way down. And I couldn't believe, so I read that this morning, and just yesterday I was talking to a pediatric emergency physician who said that he lost a baby. A baby came into the ER and ended up dying from a bleeding disorder because the parents refused the vitamin K shot, which is designed to prevent that. So there's a real cost to misinformation, and so we really are excited to get into your book and to hear some of those lessons learned. So your new book, 99 Ways to Die. Can you tell us a little bit, what there it is tell us about it.
Yeah, so the book looks at 99 very preventable deaths from diseases and other pathologies that are obviously preventable, and things that you can avoid and how to do so. It also looks at the social and historical aspects of these diseases. And it's written for everybody. It is not written for people in science and medicine specifically. I've tried to write it in a way that's engaging and entertaining and very accessible for everyone, because that's my passion. That's what I love to do. I love to create science in a way that everyone can understand it, and by using storytelling, because that's such an important part of how we pass our knowledge and information down in generations since, the beginning of humanity. And one example I always use is, when we're using storytelling, such as this book, to teach information, the information sticks. And this, you've seen it in your everyday life. A few people knew that Hamilton wrote the Federalist Papers that then became our Constitution. And then, Lin-Manuel Miranda created a Tony Award-winning, really captivating Broadway musical about it. And now 7-year-olds can sing to you all of the things about Hamilton, his wife's name, how many papers he wrote, of the Federalist Papers he wrote, things that they could have never learned before, because it was presented them in a way that they can understand it and in a way that's captivating. So that's what this book is about, and that's what I hope it does for people. It's supposed to be kind of a funny, interesting look, and kind of involves a lot of the dark humor that we have in the emergency department, because you can't learn when you're afraid. When your fight and flight is on and you're scared of things, you can't learn about them. So I tried to disarm some of these things and make them things that they're fun to learn about, and things that you don't need to be scared of because you can't prevent them.
I love that you mentioned how like you're using storytelling as a tool for disseminating medical information. And I think it was actually like Brene Brown that said that stories are just data with a soul. And I really like that. It kind of stuck with me, because I mean, you're right. Like the Hamilton example was just so accurate, because like that's how people relate to information, especially if it's like difficult medical or science or health related information, is through these stories. So my question to you is like, how did you decide which cases made the final cut here? I mean, 99, it sounds like a lot, but considering you're always in the ER every single day, you're probably confronted with new cases. Like, how did you decide which ones made the cut?
Well, first of all, not every chapter has a story, because not every, I've never met anyone with prion disease. So, there's no patient story. And there are things that I haven't seen, like a lot of the vaccine preventable diseases, because in the US, where I primarily practice medicine, we have vaccines and we have generally used them in the past. I haven't seen diphtheria. I haven't seen, I've seen whooping cough, unfortunately, but I haven't seen mumps. I haven't seen all of these diseases that are generally very preventable. I was talking to a pediatrician about that recently, how when they were young training, they're about to retire, every child had rotavirus when they were young. We don't really see that very much anymore because there's a vaccine for it. So, not every story, not every chapter has a story, but the stories that I did use, I mean, some of them kind of inserted themselves. Like, for instance, in the serial killer chapter, I've only met one serial killer, so he made it in.
Pardon?
Yeah.
You can't just say that casually.
I know. I've seen some weird stuff. So those types of things I think kind of wrote themselves in. And then there are the things that really stuck with me, and then there are other things that I don't write about. I try not to write about pediatric cases, mostly because those are hard to write about and really personal, both obviously for the patient and the family and for me. And, there's some other things that I purposely leave out, but I will also mention that I call this a nonfiction novel, because I am very specific about changing everything about these patients. So these are not real people anymore, because I'm very fierce about protecting my patients. So for instance, if it was a 50-year-old woman with meningitis, it is now a 20-year-old man with encephalitis. Like I am very, very particular about that. These are all based on real things that happened, but I am like fiercely protective of my patients. So, and I think that the important part is it doesn't matter if it's the, tortoise and the hare or the sloth and the roadrunner. The point of the story is the same, and how you're getting that information through the story, that's what's captivating. So that's what you want to try and bring to people, is something that they can understand and they enjoy. And that's what I hope this book does.
She is a HIPAA compliant queen.
Oh, yes. I'm all over it. Even the lawyers were like, okay, you've done enough. I'm like, no, I'm going to do more. I think I'm a poor editor,
Well, that's good. I mean, so that's like your patients can't read the book and be like, oh, that's me.
No, these aren't real people.
Right.
So that's not possible.
So, okay, you gave us a little nugget with that serial killer detail, which has piqued my interest. But so are there any, what would you say is the most bizarre case in the book, or one that you think people would be shocked to discover actually happened?
I mean, there's a couple things. One that kind of jumps to my mind is a woman that came into the emergency department with her pet spy.
What?
She had an animal with her that she was pretty concerned was like spying on her, and had been like, spying on her for some time. And
what kind of animal?
It was a ferret.
Oh, sure.
Yeah. I love ferrets.
Sure. Yeah. I mean, I get it.
They're sneaky, though.
Yeah. The thing about this that I think will surprise people is like that happens. And then you're like, oh, this, person is, obviously has something going on mental health wise or et cetera. Yeah. No, this ended up being something very medical and a very sneaky disease that isn't vaccine preventable, but is preventable by other means and is a huge public health initiative. that has done so. So yeah, so these are the things that, you see and you're like, oh, that's not medical. And then you find out kind of in the end, if you're not paying attention, that you miss something that's life threatening and can kill you. So.
Wow.
Okay, wait, so what did you do about the ferret?
The ferret was given food and water and was released. We he released back into the wild. And I believe he's still reporting out on her.
Oh my God.
Or maybe on all of us.
Yeah, I don't know. But very cute. Also, don't bring your pets to the emergency department.
Oh my God.
Yeah, that's a good rule of thumb.
Yeah, I mean, that time he had to.
That probably happens more often than we realize.
Yeah. And like, is there a gerbil in here? They just...
Well,
Yeah.
in where? I got to tell you, there's a lot of stories that my hubby comes home with people putting a lot of things in their bum.
There's an entire chapter in this book called Butt Stuff.
Yeah.
Oh my God. Tell us about it.
It is kind of a list of all the things that have been put in people's butts.
Yeah.
It's pretty brief. But the point being is there are things that are made for that. Do not use things that are not made for that because it can kill you. It can cause intestinal perforations. There's, so do what you got to do. Use cash, put on a mask, use your friend's credit card in Amazon. I don't know.
Yeah.
Don't put non-appropriate items, especially light bulbs, channel changers, mangoes. There's all types of things.
Well, a holiday anecdote. I've worked with a lot of clinicians, and I'll just say one of them around this time of year said that a gentleman who came in looking super, like you'd never, I don't know, like businessy. Yeah.
Sure.
And he had a phallus, he had carved a ham into a phallus. And the ham just, got lost up there and needed surgery. We laugh. It is a literal, what show. Don't do it, folks.
Pun intended.
Pun intended. Ashely, what about the most misunderstood medical emergency?
Misunderstood medical emergencies. There's a couple things. One is that often patients will get the symptoms of stroke, like ischemic and hemorrhagic neurological stroke, and heart attack confused. Oddly enough, stroke does just mean like a cutoff in oxygen supply to tissue, so it could be anywhere. But when we speak about stroke, we're usually talking about things from the brain. So that's going to be, one-sided weakness, numbness, facial droop, vision loss, usually on one side or at least one quadrant. And then, heart attack is chest pain, sweating, shortness of breath. Those are the typical symptoms, right? So sometimes patients will get these confused, and then it makes it harder for them to know when to come in. And my answer is just come in for both of them. Mm-hmm. Those are two things you don't wait on. Never ignore chest pain. So those are, I think that's one thing that sometimes can get confused. But, there's a lot of things out there where there can be like slight confusion based on either things we've seen in the media or things we've seen on TV, and these things can eventually be life-threatening.
Anything related to pregnancy or?
Oh, yeah. I mean, I think that is something that is completely underestimated. So, pregnancy, we just think of it as, these are young, healthy people. So, they're going to be fine type thing. And so many people do it, right? And we don't know that I have an alphabetized list in this book of like dozens of ways that very healthy young women can die in pregnancy.
Yeah.
So we do not, especially in our country, I think, help patients understand the full weight of pregnancy on their health and the things that can happen, everything from heart failure to pulmonary embolisms, which are blood clots that go to the lungs. All of these things increase risk. You can get preeclampsia. There are cancers that you can only get through pregnancy. So these are all things that women don't know. They want to have a family, totally, but they should be able to make informed medical decisions because pregnancy is a life-threatening situation where you have to change, a lot of things about what you do personally, and then your body changes an obscene amount for everything from how your heart beats to how you breathe. So we don't really. I think it's surprising to people because so many people do it. But, maternal mortality in the United States is on the rise, especially in certain subpopulations such as African Americans and Hispanics. And that's because this is a dangerous thing that we do, and it's something that needs to be respected, and it's something that people need to have health care for. Everything from the first trimester ectopics to what is sometimes called the fourth trimester, which is actually, postpartum. They actually see the most maternal deaths, and why, and what are we doing about that? And so I think that that's something that would surprise people. And it surprised me, honestly, when I started researching into it, how much we undervalue and misinform the public about the service that, those that are carrying the part of our population that are carrying all of the next generation, what they're undertaking and what are we doing to support that.
Well said.
So your book's got a lot of practical advice, it sounds like. You mentioned, never ignoring chest pain, all this really valuable information about pregnancy. So is there a lesson that you think you mentioned in your book that really could save a life?
There's a lot of lessons. I try to put them in every chapter, but there are some simple ones that I can tell you right now that will definitely save lives. Children under 1 cannot have honey because it can have botulism in it. And a lot of people do know that, but there's a lot of people that don't know that.
I didn't know that.
Yeah. And I think there's subpopulations that are very well versed in it. Like once you have a couple kids, people figure it out.
Yeah.
Yep.
Hopefully
That
not
makes
because
sense.
the child had botulism, but yeah. So you can't do that. Water can be deadly. Water consumption, if you drink too much of it. I mean, Brooke Shields had a seizure. It might have been why Bruce Lee died. So hyponatremia is something that can cause blood swelling, and that's low sodium in the blood due to overwater consumption. So there's these things out there that I think, take for granted. Another thing is that, in your medicine cabinet is the number one cause of acute liver failure in the United States. And although it does not cause autism, Tylenol is very dangerous in overdose. You should never take more than 4 grams in a day as an adult. And for children, this is weight-based, and you need to stick to that weight-based chart. So these are things that are, very important, but things that we maybe don't communicate well as, health educators, science educators, doctors. So this is all in the book. If you read it, I there's something in there that can help everyone, I think.
And, the honey thing really stands out because, unfortunately, I don't know if you've seen, there's a whole, natural movement pushing parents to use honey, to give honey to infants, to create homemade formula, which is unbelievably dangerous. Please do not do this. Formula is formulated very specifically to contain certain ingredients and not contain others. But there are people telling, mothers and fathers and caretakers to go out and make formula with honey, and it's just maddening. So there's also a lot of misinformation out there. People really putting out, right, bad information that could be lethal.
Yeah, and I have to mention that, formula is something, as you said, that is very specifically made. When you talk about water, you can't give water to kids under 6 months because that can cause hyponatremia in them, seizures, and death. So you can't even dilute formula, let alone make your own formula. And there are very strict standards in formula making, what's in it and how it is made. And By Heart right now has a recall because there was, botulism's in our environment everywhere, but you have to make things sterilely in order to keep botulism out of formula. So, they've recalled all of their formula. And, the FDA tracks formula. This is one of the things that we watch very closely. So making your own formula at home is very dangerous. Unless you're breastfeeding. That's fine. That's great.
Right.
Breastfeeding isn't formula, but you know what I'm saying.
Yeah. So there's something called the risk perception gap that we talk about a lot, where it's people tend to focus on things like individual ingredients in foods, versus things that actually have a very clinically significant impact on our health, like overall dietary patterns. This we're placing weight on the kind of the wrong things. So what do you think, is there a danger that you think people consistently underestimate and shrug off when they shouldn't?
I mean, I just don't think that people know what the dangers are sometimes, right? So I have, I have friends who have been like, I woke up this morning with a bat in my room. I'm like, bats are the number one cause of rabies. Rabies is 100% fatal, and bat bites are painless, and you wouldn't even know if you had one. You have to immediately get post-exposure prophylaxis for that. Go to your nearest emergency department. Mm-hmm. So there are these things that can kill you in very, horrific ways that are very preventable. This one, again, preventable by a vaccine. But you have to know. You have to know these things. You have to know that bat bites are painless. You have to know that there is post-exposure prophylaxis. One of there are, it's 99.999% fatal. There actually was one person in the United States who survived rabies, and it was a girl from Milwaukee. And her parents were asked, she was bit by a bat. Why didn't you take her to the emergency department? And they stated, well, we didn't know, and you can't expect people to know unless you're at least trying to get them the information in ways that they can understand and remember. Right. And this is information that should be out there because it's so easy. So again, that's hopefully what the book does, but you have to read it or listen to the audiobook, which you don't even have to read.
So then sort of on the flip side of that question, is there a way to die that people tend to kind of overly obsess over, but the risk is like relatively small?
Yeah, I have a lot of those, right?
Yeah,
so I think
we all do.
With all the information comes lots of anxiety. No, so one that I probably overestimate the risk of is brain-eating amoeba. So yeah, these are a very specific type of amoeba that live in high temperature waters that you can get through swimming. Unfortunately, very infamously, sometimes neti pots that don't use sterilized water, people can get them through this. So the risk is probably not that high, but again, very preventable, right? Don't submerge yourself in hot springs and make sure that the water that you're using in the neti pot has been boiled or is sterile. So that's probably, there's a couple of those in there where people are like, oh, well, a lot of people don't die for this. I'm like, yeah, but anybody dying from this is unnecessary. It's very preventable. So there are a couple of those things in there. And that's probably one that's a little overestimated for me. But, just careful swimming in hot springs.
So hearing about your background and a lot of the work that you've done, like consulting with media, that's so cool. Love it. Is there an example of a medical misconception that you maybe helped correct before it reached millions of viewers?
There's so many out there, right? So, you can't sleep after concussions, searching for bullets, trauma surgeons searching for bullets, people popping up after CPR. These are all wrong. So you can sleep after concussions. You actually must if you want to improve your concussion. Trauma surgeons do not search for bullets. If they happen to see it, they'll grab it, but otherwise you get to keep it. And CPR, less than 10% of out-of-hospital arrests will regain a pulse at all, let alone wake up. So these are things that are misinformations that are perpetuated by TV, maybe because they fit storylines or maybe just because people, who are writing don't specifically know about these specific pathologies. So there's a lot of opportunity. What have I personally done? Well, I've worked with a lot of really amazing people, and I think that has been something super fortunate, and I feel blessed to have gotten to speak and work with these people because, as I said before, a lot of them are highly invested in creating, realistic art, but also using their power as an opportunity to improve public health. So one picture that I worked on was with it was for HBO, and it was a J.J. Abrams production. So I got to work with him a little bit, and Kira Snyder and Far shot. These were people that were like producers on the show and writers. And they were all like just amazing people who really wanted to create something that was realistic, but also that was interesting and smart. And I think that is the investment that people are making. That TV show, unfortunately, did not go to production, which is always a bummer, but just part of the process. So I think that one of the things that I did that's popping up in my mind is that I worked on a television show called The Purge. And they wanted to there was a very stressful moment where the doctor in the TV show had found out that the person that tried to kill him the night prior was his patient, and he tried to save him from dying. And the whole thing, I guess, was, it's obviously very stressful. And so the doctor went outside and he's like, and then we think we're going to have the doctor smoke a cigarette. And I'm like, no, you can't do that. One, within 50 feet of a hospital building. So just no, but also like they wouldn't do that,
Right.
you know? So, I mean, that even wasn't that medical. It was more just, realism. Like, let's try and do what these people would actually do.
Very cool.
Which you can be frustrated and find other ways to cope than smoking next to a hospital. So that was not put in there. I don't know if it was because of me, but I was always very happy to not see that included.
So before we ask you our final question, which Sarah's going to ask you in a moment, you often say, check with your doctor, not your favorite influencer. I will give the caveat that many of us in SciComm are sort of trying to, I don't know, be.
Somebody's got to.
But that being said, the zone is flooded with folks who don't have backgrounds in medicine and science. So, what would you say, some key takeaways? What's the harm of medical myths and entertainment and social media? And what would you want to share with the folks tuning in?
I mean, the harm is it costs us lives. And we saw that during the pandemic, which was a time when medical misinformation, especially on social media, ran rampant. You saw that people died from hydroxychloroquine and taking inappropriate medications. So, there's a lot of unnecessary harm and loss. I think you have to be careful where you're getting your information from. What I always tell people is, get your information from someone that you trust health-wise. Don't get it from online. If you are going to consume information online, make sure you know who those people are. And, always try and go back to your primary care doctor to confirm the things that you are doing with your health and to make sure that they're the right things and that you haven't been influenced into doing something that could be harmful or unhelpful to you or your children. And, I used to say to look toward the CDC, but my caveat now is to follow the American Academy of Pediatric guidelines for peds and look towards the medical groups and try and get your information from them because they seem to have the safest, most scientific based information. And there isn't, you always have to look for people's biases. When they're online, are they selling you something? Is there a reason that they are telling you this supplement could save your life? Or is there a link below to click it and buy it? You don't want people that are selling you things online to be giving you information about your health. So just be careful out there. It's not an easy landscape to navigate, and we can all fall victim to it. I mean, heck, I bought that sports bra that Taylor Swift had that's supposed to fix your posture.
Huh?
It doesn't fix your posture, but it's nice.
Oh my God.
This is the first time hearing about this.
Oh, we all fall victim to it, and I get it. And we're human, and healthcare is hard to access, and we're trying to do our best. But just protect yourselves out there.
Yeah, absolutely. All right. So, Ashely, we like to close things off with a little bit of a more hopeful note. I know there's not a whole lot out there right now, but if you could try and think of something maybe in health and science and the world right now that's kind of giving you hope for the future.
I think the thing that makes me most hopeful is seeing the people in health and medicine and science that continue to invest their time and their money and try and create something that helps people even with nothing in return. So I see a lot of people doing things like writing books and creating podcasts and going online and trying to fight misinformation. And I think there's all these people out there being like, oh, they're being paid. This has even happened with my book. There's a comment somewhere that states that I must have been paid by big pharma because I talk about vaccines. I was not paid by anyone. I've actually sunk money into this book. Like I make money by going to work and working like everyone else. I don't make money through being a writer really yet. And no one is sponsored.
We get that too. We get that too about like we're shills of big pharma.
I know. I'm like, I've never gotten any money. No big pharma has ever sponsored me. I've never taken a dime from anyone. $600,000 of medical school debt. Like this was not the way to go if you wanted to make money off of people. Let me be clear. So the fact that there are people out there doing the right thing and trying to help people, even though it doesn't necessarily benefit them. And these are very smart people. They could be doing other things. They could, go do investment banking or something. And they choose to do this because it gives their life purpose and because they want to help people. And so, that gives me hope amongst a sea of, misinformation and bad news.
Yep.
We're doing our best.
Yep. Preach. Well, Dr. Ashely Alker, everyone has to go out and read 99 Ways to Die. We will go ahead and link this in our show notes, push it out in our stories and all the things. Thank you so much for everything that you do and for writing this fantastic book. I can't wait to read it.
Thank you guys for everything you do. And thank you for having me. I'm so excited to be on this podcast. So I'll keep following you guys for my information.
Where can we follow you? Where can we find you on social media or anything?
Yeah, so I'm always A. Alker, so AALKER MD on everything from TikTok to X to Blue Sky to Instagram. I apologize, I am not great at social media, but I'm doing my best and I'm trying to help fight the misinformation out there and, just doing what I can for the cause.
Yes, thank you so much. Sarah, take us home.
All right. Thank you all for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.